Hey everyone, it's Luke again for the third video in this sequence. This sequence is talking about how to self-diagnose different types of low back pain and sciatica pain. If you didn't check out the first two videos, go ahead and watch those first because those ones are a little bit easier to diagnose and understand. So the first one was disc bulge pain. The second one was more of the degenerative arthritic type pains. And this third one is SI joint pain. And the reason you leave this for the third one is because this one's a little trickier to deal with. So again, if you haven't watched the first two, go ahead and watch those first, because to diagnose the SI joint pain, it helps if you can kind of disclude those first two. So if you can kind of rule out, no, it's not a disc bulge, no, it's not the compressive stenosis, degenerative type pain. If you can check those first two off the list, then you're at least already starting to think along the lines of SI joint pain, and then you can do a couple other little things to just kind of fine tune it or kind of narrow in. So basically with SI joint pain, your SI joints are right here along the back of your pelvis. So typically you're going to have pain right where you put your thumbs in those dimples, and it should be pretty well localized. You may have some pain in the middle too. That's not going to be your SI joint, but as a lot of people know, unfortunately, it may not just be one type of pain. That would just be too easy for some of us. So you may have two types of pain, or maybe if you're really lucky, you have three. Let's not go there. Not go there though, excuse me. So SI joint pain, again, if you touch it, you can usually touch it. Put your finger in that divot, it's usually going to hurt there. And then the other common thing you're going to look for is that you're not really going to have that true sciatica, which we would kind of consider pain traveling down the length of the leg, at least into your thigh and stuff. Typically with your SI joint pain, if you're having sciatic pain with it, it's going to be more like into your buttocks. So you can usually, again, poke through there, feel through the buttocks. Other common things you're going to look for is if it hurts if you cross your leg. A lot of times it'll hurt if you sit, especially if you're sitting like in a shifted position with your pelvis. And sometimes like your single leg activities are going to hurt too, just because of the force and the tension put through your SI joint. So again, it's kind of a diagnosis of exclusion plus a little bit more hands-on, not quite as cut and dry as the disc bulge or the stenosis, degenerative type pain. So, but that's the third one. Those are our most common three causes of back pain and sciatica. So hopefully between those three you can kind of put together a working model in your mind what you're dealing with. And then of course in some future videos and information we'll start to give you some tips on treatment. So there you go for now. Thank you for watching, and hit me up with any questions that you have either underneath the video with a comment, or you can give me a call or shoot me an email. Thanks.